first I'm going to introduce myself. My name's Steve West. I'm currently Resource and Planning Transformation Programme Director at East of England Ambulance Service. My background over the last 40 years is working in the NHS, primarily in ambulance services across the UK, and I've worked in 5 different ambulance services with 20 years at board level across the UK. About 8 years ago, whilst working at South Central Ambulance Service, I moved into a planning and performance director's role, the first one in UK Ambulance Services, and developed a new approach to how we planned service delivery within ambulance services, and that's pretty much what we're going to talk through today. Next slide, please. So what is integrated planning in the context of an ambulance service? So the way we built 3 key areas of planning at South Central Ambulance Service, we had 3 distinct models. One, mapping out our operational requirement, our demand that we anticipated, and our resources to match against that. Alongside that, we had a financial model and we had a workforce model. And historically, the 3 were pretty independent. We started to bring them together on 3 Excel spreadsheets, originally with lots of copying and pasting, but building a model where patient demand drove the resource requirement that we needed to put out in order to deliver performance. That played through to inform how much workforce we needed to recruit, both short and long term, and equally the budget setting of the organisation. So we started to integrate how we planned and how we managed against that plan, with the 3 teams working together to create the plan and to deliver it. And ultimately, we moved that integrated model from spreadsheet into a system called Anaplan, which really helped us to leverage what we'd learned and developed in a much more effective way. I think externally, aspirationally looking to link that demand and capacity planning within an ambulance service to demand and capacity planning across the health system, so that we can work more effectively as a system. Next slide, Olu, please. So how did it improve response times and efficiency? So we were, as most of the NHS is, in a resource constrained environment, whether that's people resource or financial resource, and using optimal use of both against a forecasted demand is really where our integrated planning model really came to the fore. So ensuring that you plan your resources against the demand profile in an ambulance environment where we're twice as busy at 2 o'clock in the afternoon than we are at 2 o'clock in the morning, 20% busier in December than we are in April, and matching that profile effectively really helps to ensure you drive consistent response time delivery and ultimately patient outcome, making sure you get the best use of what resource you do have available. Working longer term to ensure your workforce plans are providing the right level of people to be able to deliver the hours that you need against that forecast requirement, gives a stable platform, and it's a well-proven model in an ambulance or logistics environment that the utilisation of that resource is really critical in delivering response times, and maintaining that utilisation is really, really key to deliver consistent response time performance. And the next one, Olu, please. Technology has played a key part in that. So we started off building systems in Excel, very quickly found errors, not unsurprisingly, in copying and pasting data and trying to link data from one spreadsheet to another. Equally, our resource planning forecasting model that we built very quickly outgrew the capabilities of Excel, and it would take us 15 minutes to open that spreadsheet, which just wasn't feasible. So we moved to a platform and move those models into an integrated solution within Anaplan. That really enabled us to run much larger forecasts, longer term forecasts, really start to look at strategic planning, taking that patient demand forecast, pushing it forward for 5 years with a high degree of accuracy, converting that into what our workforce plan requirement was for a 5-year plan, and how we would deliver against that, what that would mean from a budget perspective for 5 years. So really starting to use the advanced technology and capabilities of a system such as Anaplan to be able to look much more strategically and create a stable platform for the delivery of performance. Alongside that, we also, within that platform, were able to leverage the use of AI, to use the buzz terminology, but a lot of statistical algorithms to really enhance that forecast and start to break the forecast down, not just to raw outline numbers, but also down to disease profiles, linking it into weather patterns, and really start to create a much more sophisticated forecasting mechanism, so the organisation could be much better prepared and planned to respond to those peaks and troughs in demand that we consistently see. And the next one, Olu, please. Olu, do you want to go on to? Oh, right, okay. Can you describe the financial benefits? Being able to really improve the forecasting accuracy in a system where that's driving what resource you put out really starts to optimize that planning process, and makes best use of the resource that you've got. Because we linked the output from our Anaplan system to our workforce management system, our scheduling team were only scheduling resources against a forecasted demand profile. So we were never over-resourced at times and massively under-resourced at others, which had been a historic profile. And we were able to work through the more accurate our forecast was, by 0.1% improvement in forecast accuracy gave us about £100,000 per annum of saving through resourcing in that effective way. So there's significant financial benefits internally with improving your forecasting accuracy and resourcing against that effectively. However, if you look at the potential for integrating across the health system and linking what's probably the biggest risk in ambulance services to delivery of performance at the moment, which is the link with ED departments and ambulances queuing outside ED departments, the potential to integrate our planning as a system, and for our output to feed into an input in an ED department, and for them to resource effectively in a similar way, the opportunity to reduce ambulance queue in ED has the potential for saving many millions of pounds across the East of England region, as well as really impacting on improving patient care and outcome. So whilst our internal savings from better processes, the potential for greater efficiency as a system is really quite significant. And the next one, Olu, please. The key challenges in implementing an integrating model has ever taken people with you with a new concept, combining the efforts of key people within the operational team, the finance team, and the HR team with the vision of bringing together an integrated model and starting to believe in the forecasts that are produced, being able to evidence the accuracy of those forecasts. They're not predictions, and they won't be exactly right, but we were around 97% accurate with our forecasts. So I think, as ever, hearts and minds is a challenge. Getting the right technology, finding a system that can support effectively what you're looking to deliver, and the data analyst capacity and capability within the teams is also really important. There's a lot of data that we have available to us within the NHS. The ability to leverage that is really dependent on some very critical data skills that are scarce, to say the least. So building that data capacity and capability equally really important. And the next one, Ollie, please. In terms of how does it impact on our staff? If you get your demand and capacity wrong, then the staff have a really bad day at the office. Effectively, the stress levels of working under that significant understaffing consistently really affects the stress, and it becomes a really negative cycle where sickness will go up, fatigue will increase, absence will increase, all really a negative cycle. Starting to really find a sensible balance and approach to how you plan your resources against that forecasted demand level starts to take some of that stress and some of that pressure out, starts to balance it across the week, gives you the ability to look weeks ahead and see where those pressure points are and do something before it happens, as opposed to trying to react to it once you're in the middle of an incident that you're responding to. And then you start to create a more positive cycle. And I've seen this as an example at South Central Ambulance, where we were pretty good at our planning with where we'd got to. We were consistently delivering national performance for a number of years. We were in the top 2 ambulance services nationally, went into the pandemic, and as in a lot of places, the world changed for us. We suddenly saw real stretch, and we saw a lot of our baseline indicators really starting to move. Job cycle started to take longer for crews to do jobs. Sickness levels went up significantly, and the more stretched the resource levels were, the more those key assumptions started to become challenged. As we started to bring additional resource in and balance that stretch more effectively over the coming months, we saw those indicators, those key indicators of stress, start to improve really quite rapidly. Attrition went down, sickness went down, job cycle times went down. Really, for me, was a really positive example of saying, if you get the demand and capacity planning right, the environment for the staff to operate clinically effectively and reduce their stress levels is really quite important. And the next one, Ollie, please. Ultimately, improving response times impacts directly on patient care. The potential for stopping patients and ambulances queuing outside ED have a massive impact on patient care, removing patient risk and improving their experience. And having a workforce that isn't stressed, with the right level of resource, responding in a sensible time to patients, equally has an impact on the patient experience. A workforce that's in the right frame of mind provides a much better experience for the patient ultimately than one that's stressed and rushed which isn't a good place to be. So I think we're creating an environment to deliver effective patient care on many fronts. Now the next one, Ollie. I think the future of integrated planning in the ambulance services, I think more ambulance services are now developing their models and really building on the success of the GDE program that was the forerunner for this at South Central. So we're seeing more and more ambulance services adopting this. I think the most exciting area is seeing health systems equally starting to plan using systems such as Anaplan, and the opportunity to link our demand and capacity planning at the front end of the patient journey into an ED department and acute hospitals demand and capacity planning, and then through to the community. So the whole patient journey has effective integrated planning across the health system, has the opportunity, I think, for real benefits for patients and for the health economy. And the next one, Ollie. Right, okay, that's all. Thank you very much. I hope that's been helpful and informative. Thank you.